Good afternoon, everyone, and welcome. I am Jessica Turner, the president of Outdoor Recreation Roundtable, and I'm thrilled to open the first ever webinar series on health and outdoor recreation. So for years, ORR has demonstrated the economic power of the outdoor recreation economy, a sector that generates $1.2 trillion and supports over 5 million American jobs. But beyond the numbers, we all know that outdoor recreation is not just good for business. It's good for people, community, and society as a whole. Time outside improves physical health, mental well-being, social connection. It lowers stress, strengthens hearts, supports immune and metabolic function, and inspires stewardship of the lands and waters we all rely on so that these health benefits can be carried forward for future generations. So through this webinar series today and in future weeks, as well as ORR's National Recreation Executive Forum, which will be on health next May, or shining a spotlight on how time outdoors can and should be recognized as a cornerstone of better health. And with that connection made, how we all should be driving towards improved access to these outdoor recreation assets, as well as improved access to gear, equipment, apparel, vehicles, and services that make it easier for everyone to spend as much time outside as physically possible. I want to thank Cassie and our incredible panelists for leading today's conversation, for all of you for being here. I actually started my day, we were just talking about this, with a trail run in an urban park about a mile from my house. So I'm eager to hear all the health benefits just running through my body today. And with that, I'll pass it over to our moderator, Cassie.
Thanks, Jess. And thank you again for joining us today. My name is Cassie Elrod. For those that don't know me, I'm the Program and Administrative Director at ORR. As Jess mentioned, today's webinar on nature as medicine, the lesser known physical health benefits of time outside, is the first in a three-part webinar series exploring the intersection of health and outdoor recreation. Today, we're going to be looking at the science and systems behind something many intuitively feel, which is that the outdoors truly functions as a public health infrastructure. Our panelists will unpack how time outside supports cardiovascular health, chronic disease management, and even gut and immune health, illustrating how healthy ecosystems create healthy humans. I'm honored to be joined today by three leading voices in this space: Allison Colman, Senior Director of Programs at the National Recreation and Park Association; Dr. Amber Fyfe-Johnson, Associate Professor at Washington State University; and Rohan Jyothinagaram, Government Relations Manager at American Heart Association. Allison and NRPA's work champions equitable access to parks and recreation, supports evidence-based programming to boost physical activity and health, and helps communities harnessing outdoor spaces as a frontline tool for preventing chronic disease and improving well-being. Amber's research at Washington State University explores how early childhood exposure to outdoor environments can influence gut microbiome diversity, immune function, stress management, and overall health. Her study of children in outdoor preschools is breaking new ground by linking nature contact not just to physical activity, but also to digestive health and resilience in young kids. And lastly, at the American Heart Association, Rohan leads work on outdoor recreation, active transportation, and physical activity policy, helping mobilize support for legislation like the Explore Act and efforts to expand access to parks and trails. As a steering committee member of Outdoors Alliance for Kids and with a master's in public health, he bridges cardiovascular health goals with nature-based policy solutions. If you have any questions for the panelists during our discussion today, we will be having a few minutes of Q&A at the end of the webinar. So please put your questions in the Q&A function of Zoom at the bottom of your screen. And I know we're all excited for this discussion, so we're going to go ahead and just dive on in. And Allison, we're going to start with you. NRPA has a long history of supporting park and recreation professionals as they design outdoor spaces to meet community health needs. Paint us a picture of your perfect park that is suited to address chronic disease. What does it look and feel like?
Well, thanks so much for that question, and thanks for inviting me to be here today. I'm super excited about this conversation and the opportunity to be with so many like-minded peers and folks really interested in the intersection of public health and nature and green space and parks and recreation. So just kind of quickly wanted to share a little bit more about NRPA. For those that aren't familiar, we are the leading national nonprofit organization really dedicated to advancing parks, recreation, and environmental conservation efforts that enhance the quality of life for all people. And as you said, we have a long history, over 60 years, of really providing local park and recreation agencies and professionals with guidance on how they can really maximize their places, their services, their offerings to improve community health and well-being. At NRPA, we provide everything from research to advocacy to professional development to programs and grants that's focused on building stronger, healthier, and more resilient communities through the power of parks and recreation. I know we're going to dive into the evidence today. More and more evidence is emerging, documenting just how vital parks, green space, nature is to health and well-being. There's no longer this belief that parks and recreation are just a nice to have or an amenity in communities, but really starting to see them as critical public health infrastructure. They are capable of driving health, social, economic, environmental benefits for individuals and communities. And their versatility really makes them one of the most cost-effective investments that we can make to improve health and well-being. So you asked about a perfect park, and I want to get to that answer. And I want to really focus in on this really shared understanding that there's not a one-size-fits-all perfect park. And at NRPA, we are really focused on and we lean into the research and the evidence base that tells us that there are some guiding principles and strategies we need to focus on when designing and activating parks that can create really well-utilized, vibrant, and thriving parks and park systems across this country. So the research really tells us that if we want parks to be well utilized and therefore great, then we have to focus both on infrastructure improvements and access to the physical space, as well as a couple of key activities: community engagement, activating parks, trails, and green spaces through programming and services and events, building public awareness and public support for these spaces and the programs and services that happen there, and addressing other access enhancements, things like walkability, accessibility, safety within the park. Those are the factors that really drive increased use of parks, trails, green spaces, recreation centers, athletic facilities, and produce those health outcomes, right? In terms of improved physical health, addressing and managing chronic disease, increasing physical activity to improved mental health and social well-being. So there's not really a one size fits all, but it's more of what are some of those guiding principles and best practices as we are designing parks that are intended to promote community outcomes. The other piece that I want to mention is that we can't just be focused on those principles, but have to be focused on really how do we maximize and leverage the full power of parks and recreation. And in January, NRPA launched our new strategic plan, which is really leaning into this public health framework focused on 7 dimensions of well-being. We are moving beyond the physical, right? When we think about health outcomes, and we're focusing on the whole person and the whole community, and really that holistic approach to well-being. And so this framework focuses on placing equal value on the cultural, the economic, the environmental, the intellectual, the mental, the social, and the physical health and well-being benefits and community outcomes that parks and recreation can drive. And when we think about the things that make an individual or a community healthy, and the role that parks and recreation plays as this versatile force for good, we really believe there's no other local government service or institution that's capable of driving these outcomes across each of those dimensions as much as parks and recreation. So perfect parks in our mind, got to focus on engaging community, got to focus on activating those spaces, have to focus on addressing other access barriers, but we also want to be focused on how do we drive community well-being across these 7 dimensions. So I'll leave it at that. But in summary, perfect parks are really those that are well utilized and loved by community members and produce those outcomes. And I'll throw a link in the chat to those 7 dimensions.
Amazing. Thanks, Allison. The idea that parks and trails is public health infrastructure, as you said, and not just a luxury or just thought of as a playground, it really underscores that, design itself can be preventative medicine. And something as simple as walkability and safe green space that you mentioned can actually change these public health outcomes. Rohan, we're going to move to your perspective next. American Heart Association has long linked physical activity to reduced chronic disease and better cardiovascular outcomes. How is that messaging evolving as outdoor recreation becomes part of the national health narrative? And what does the outdoor industry need to do to cement our role in this space?
Thanks, Cassie. Well, first of all, we're really glad to see the visibility on the national stage of nutrition and physical activity as interventions to treat and prevent chronic diseases. But I want to highlight it's very important that these recommendations are made after a robust review of peer-reviewed literature and grounded in hard science. That's the first most important thing. Going back to the accessibility of the outdoors, we have to make sure it's accessible for all. For example, if someone lives in an area, I know Allison was talking about, if the space isn't accessible, of like poor air quality, encouraging them to go outdoors might fall on deaf ears or be potentially dangerous. The American Heart Association, we advocate for regular physical activity. It's one of our life's essential eights, being active, which can help with managing weight, another one. But people can't do that if there's not safe and adequate infrastructure for them to do so. As far as what industry can do and is already doing, and I think could continue doing, is having these, not only just having these conversations, but forming these partnerships and coalitions to help move public policy at the state, local, and federal level. I can only speak for the federal level, but I know AHA operates in all of those spaces. Any policy that makes it easier for Americans to get outside and move their bodies. I always like to say nothing gets done in Washington without a diverse coalition of stakeholders, whether it be industry, trade associations, patient groups, variety. We're lucky at AHA to partner with many great organizations in this space. A lot of them are on this call. Some existing partnerships, as you mentioned in my intro, is the Outdoor Alliance for Kids, which both us at AHA and I know NRPA is also a member. Additionally, Outdoor Alliance for Kids share some members with the Roundtable. And so I believe first things, the continuation and expansion of these partnerships are really critical to improve access to the outdoors, create new infrastructure, maintain existing infrastructure. These are all really critical to improve our public health.
Thanks, Rohan. I really liked how you linked it back to equity as well in the beginning of that, and that the idea that access to trails and parks is a health determinant and not just an amenity. And then the focus on relationship and coalition building is obviously so important and why we're all here today. Thank you. Amber, moving to you, it seems almost supernatural that time outside can alter our gut health, but this is a topic that you understand better than most and is really getting center stage in the health world at the moment too, so super timely. Can you explain to us what's going on, what's happening biologically when we spend time outdoors?
Absolutely. Thanks, Cassie, for the question. And again, I want to echo Allison and Rohan's sentiments. It's just such a treat to be here. I'm an academic, so I geek out with scientists, and I'm out in the field doing data collection all the time. So it's really an honor to be in a community with people who are really pushing this forward in a different space. And as a scientist, I do science to inform policy change and to inform changes in infrastructure. So it's just a treat to be in a different space with like-minded people, but who do really important pieces of this work that are not part of my day-to-day. So I think I am really interested in the influence of outdoor time and nature exposure on gut health, particularly in kids. My work focuses on pediatrics, which you know. So I want to just frame this before we get into the nitty-gritty that really there are good bacteria and bad bacteria in the world. And good bacteria we largely call commensals, and that's what I'm going to be talking about today. So it is important, I think, to remember that not all bacteria are good, but largely in the gut microbiome space, what people work on is commensals. And our bodies actually have more bacterial cells than human cells, which is sort of wild, but it's important to remember. It's not just a little few microorganisms hanging out in our gastrointestinal tract. It's a huge amount of microorganisms, and that's one of the reasons it's so important, that it's systemic. It's on all features of our body, but today I'll be talking really just about the gut microbiome. What we've learned over many years is that family life and environmental exposures largely influence the gut microbiome. So why is this? Because microbial ecosystems are place dependent. So where we are in the world influences our gut microbiome. So if you travel to Brazil or Australia or China, your gut microbiome changes, even if you're on vacation. So it is really adaptable and flexible, which is really exciting from a health perspective, because it means we can influence it and change it. And so when you think about kids or humans, but I'll talk about kids in this specific space, a kid who attends a preschool that has sanitized surfaces that are vacuumed regularly by janitorial services has a really different exposure to a microbial ecosystem than a kid who plays in a park all day. And so one of the reasons I do work with outdoor preschools and partner with outdoor preschools is because there's an extreme difference in the exposure, right? It's not a kid going to a park for 30 minutes. These kids are in forests for 4 hours or 6 hours a day. They get a very different exposure to the microbial ecosystem than a kid who's in an indoor preschool. And it allows me really to compare the difference between how microbial systems, or how the gut microbiome or the microbial ecosystem in an individual human differs compared to an individual human in an indoor location. And what we're finding is that, to no one's surprise, because whether we like it or not, what kids touch goes in their mouths. And while we think that's isolated to kids, spoiler, adults do the same. So what we touch ends up in our mouths, and what ends up in our mouths ends up in our gut. And that actually, on average, when we're talking about good bacteria, right, is a positive. It's a win. So the summary is that kids eat dirt, and that is good for them when we're looking at gut microbiome characteristics. So I have preliminary data in this space, and I'm doing a large 5-year NIH-funded project on this exact thing right now, but the preliminary data were really promising. When we compared gut microbiome characteristics between kids who spent a lot of time outside and kids who didn't, there was a fairly substantial difference after adjusting for other features that influence gut microbiome, like diet, like medication, like physical activity. So after adjusting for many other things that influence gut microbiome, we think there's a pretty substantial independent effect on the gut microbiome when people are outside. So I'll land there. There's a lot to talk about this in this space. We could talk about the different microorganisms that changed, but I think largely speaking, commensal, so healthy gut bacteria, shifted for the positive in kids who had a lot more time outside.
Thanks, Amber. It's so fascinating that, just these environments literally nurture healthy microbiomes. I know we have a lot of different outdoor industry segments on this call. And so my first thought was, yes, the soil component as well. But what about, kids that spend time on water? I currently live off the Arkansas River in Colorado, and I see the children in our community always on rafts, on kayaks, swimming in the river. Is something like that beneficial as well?
To the best of my knowledge, that has not been explored.
Okay.
I don't know that for sure. I mean, I think there's very little work in the microbiome space currently. There's some, and it's accelerating, but I have not seen any with blue spaces, is what you're sort of summarizing, right?
Yeah.
Most of it is in green spaces. Great question.
Yeah. And you started hitting on this, but what's emerging in the science about how these outdoor environments shape immune and metabolic functions specifically?
So I'll speak to the cardiometabolic function because that is what I know best. And caveat that the literature in the immune system space is accelerating as well. Both, I think, immune system and gut microbiome health are newer. They're not brand new, but they're newer. And the evidence in the cardiometabolic space is much more robust. So what largely we have found, and this is including my individual work, but also a systematic literature review that I published in 2021, which is a summary of the evidence to date in a very systematic, protocolized way, was that time outside in kids in particular improves physical activity and cardiometabolic health largely by reducing sedentary time and promoting moderate and vigorous physical activity. That's really important. We hear this all the time, but it's actually really important that a systematic literature review found that, because I think, as Rohan shared, it's a little bit, it can be easy to cherry pick studies that align with a statement, and when you encapsulate all the literature, that's really important, because it sort of balances out a lot of different findings. I think the other pieces that I think are newer but really exciting in the cardiometabolic space is that outdoor time promotes sleep. So not just sleep duration, but also sleep efficiency, meaning that even if you don't sleep that long, if you sleep 6 hours, those 6 hours have more REM sleep, for example, instead of being really disrupted with frequent waking. So I think the literature in the sleep space in cardiometabolic health is looking really promising. Also lowering cortisol and reducing stress and other sort of pro-inflammatory biomarkers. So, and that transcends into blood pressure is probably the main cardiometabolic deliverable. Clearly cortisol, pro-inflammatory cytokines influence other features of cardiometabolic health besides high blood pressure, but I think lowering blood pressure is important. And the last piece is supporting a healthy weight in terms of, and that's largely through physical activity. But I think that what I am really excited about in the cardiometabolic space right now is sleep and cortisol, the stress response, because we know that those are sort of intermediate variables that influence a number of cardiometabolic outcomes downstream. And so if we can promote sleep and sort of turn up the volume on kind of an anti-inflammatory response, that's going to be largely very helpful for multiple systems and multiple cardiometabolic outcomes.
Thanks, Amber. I think a lot of what you said really just overall underpins the movement right now for both children and adults to just get away from screen time. It's disruptive in so many levels, reducing physical activity, also disrupting your sleep. Many of us are looking at our phones right before we go to bed. So I think all of what you said is just super important. Really, really cool information. This next one's for both Allison and Rohan. From your perspective, what examples have you seen where intentional park and recreation infrastructure or policy investments have measurably improved physical health outcomes?
Yeah, I think it's a great question, and I'm happy to kick us off. So, there are so many studies and examples that are out there now. The evidence base has really been growing over the last 2 decades around the values that parks, trails, green spaces provide in terms of health, social, environmental, and economic value. So I do want to flag in 2022, we released a literature review in partnership with the Urban Institute that drew from over 100 studies documenting the health benefits of parks. We'll make sure that that's shared after the webinar as well. But some of those key findings, certainly on the physical health side, that's probably the most well-documented set of benefits that parks and trails provide in terms of getting people more physically active, addressing chronic disease, helping to manage chronic disease. In fact, a lot of park and recreation agencies offer evidence-based physical activity interventions in parks and community centers to address things like diabetes and arthritis. But some of those key findings that I just wanted to point out, we were just talking about this, People who live near parks are more likely to use them and achieve the recommended levels of physical activity, especially children. Children who don't have access to parks are more likely to be physically inactive, more likely to have excessive screen time, more likely to not be getting the quality of sleep that they need, and more likely to be overweight or obese, which could spur additional chronic disease in the future. At the same time, we're well aware of the mental health benefits that parks and green space provide, decreasing stress, blood pressure, reducing symptoms of anxiety, depression, positively impacting your ability to connect with people and address things like social isolation. We have a growing social isolation epidemic in this country. And so there's so many health benefits in addition to the environmental role that parks and recreation play: cleaner air, cleaner water, addressing rising temperatures, absorbing storm water, and of course the economic value. There's some great studies that are out there, according to the Trust for Public Land. For every dollar invested in parks, we're seeing a $4 to $11 return on investment in healthcare cost savings and economic returns, driving property values, tourism, attracting new businesses. So they are a smart investment. And what we need are more parks and to address those gaps, right? There are still 100 million people in this country that don't have access to a park within a 10-minute walk of home. And then there's that question of, is it a high quality park? Is it well maintained? Is it community driven? Is it activated? And so some of the examples that are out there that we're really focused on from a policy change perspective is really looking at where there's underutilization and disinvestment in parks within a park system. One example that I want to share is from New York City. They launched their Community Parks Initiative in 2014. So 10 years into that, it was a $300 million commitment to redesign and renovate almost 70 neighborhood parks. They looked at their data and determined where parks had basically not received any investment in the last 20 years and allocated $250,000 in capital investment into those parks. These were in areas that were densely populated. They were growing neighborhoods, seeing a lot of population growth, and they were in communities where there were higher than average concentrations of low-income residents and greater health disparities. So there was also that equity lens really applied to the criteria for where these park investments would happen. They, added improvements like shade, seating areas, play equipment, benches, sports amenities, exercise equipment, really driven by the community. They went through extensive community engagement processes on each of these park renovations, engaging community-based organizations, hosting meetings, doing surveys, really getting that input on how folks would like to use the parks. And an evaluation of those investments did find that there are now more people who are using those parks. They're spending more time in the parks themselves. And when compared to control groups, there's really increased use of those park systems. So this is a great example of really a systems change approach of looking at the data, looking at the historical investments that have been made across that full park system, and leveraging financial resources as well as other resources available to the Park and Rec Department to make those investments and improve those spaces driven by what the community members wanted and needed. So that's one example that we love to lift up. It's showing increased use of park. Folks are getting those physical, mental, social health and well-being benefits associated with using those spaces. But it's something that's replicable across the field. And we're seeing more and more park and recreation departments really using this approach, looking at the data, engaging community members, allocating resources based on need.
Great. Thanks, Allison. Rohan, did you have anything to add to that as well?
Yeah, I mean, those are great examples. I'll just flag two more. One would be the more on a macro level, the Every Kid Outdoors program that was established in 2015. Originally, Every Kid at the Park, AHA, along with a bunch of partners that are, a lot of them on this call, played a big role in establishing that, administered by the NPS and other agency partnerships that allows fourth graders to have those free park passes. As Amber was alluding to, yeah, the research shows that the younger that kids develop these habits, the more likely they are to continue them into adulthood. So that's why it's really crucial that we get it at these young age. And fourth grade showed to be one of the more optimal ages as far as in terms of forming a relationship with the outdoors. Recently, this program was extended till 2031, as I think Cassie, you mentioned, due to the Explore Act, and that was a result of a lot of advocates right here. And so I want to thank everyone and all their hard work to get that across the finish line last Congress. There's also current legislation trying to codify this program, but I can expand more of that later on the call to action section. The other one I wanted to flag was safe routes to school. We really not just physical activity as recreation, but if you can just integrate it into your everyday life. So Safe Routes to School is the national initiative that promotes biking, walking, rolling to school through infrastructure improvements, safety education, and community engagement. Similar to EKO, if kids start doing this earlier in life, more likely to be active in adulthood. In terms of specific investments, one study showed that every dollar spent on Safe Routes programming can yield up to $4.40 in health and safety benefits. The Safe Routes Partnership, which is the advocacy organization that promotes these programs, does a lot of great work and has more detailed information. They're a great partner. I just wanted to give them a shout out. But yeah, those are another one is transit trails. We talk about the accessibility to parks. That's a proposed grant program to get public transit so that people can have access to these facilities. There's a couple local examples, but I know there's effort on the federal level to create a federal grant program to replicate that across the country.
Thanks. Those were really great examples, and it's just so encouraging to hear these wins, because it really just shows how, infrastructure investments translate directly into public health impact, community wellness, and as well as having that focus start at such an early age. It just sets people up better for life. So those were great. Amber, back to you from your research perspective. What can policymakers, educators, recreation organizations learn from the outdoor preschools you were talking about earlier about fostering long-term physical health from an early age?
Yeah, so I want to bookend what Allison and Rohan were just sharing, that I think park access, and both locally and bigger scale parks, is such an important feature in terms of kids getting access to outdoor spaces. I think the other piece, which is where my work largely focuses, is on access at school. And why that can matter is because some kids don't necessarily have the opportunity to be in outdoor spaces independent of access. And also because some of my work has shown that actually time outside at school is often the biggest chunk of outdoor time that a kid gets in a given week, because kids are at school for so many hours in the day. Just based on that alone, focusing on schools is also a really nice way to bookend this. So there's access in their neighborhood, there's access on sort of like a national park level and sort of variations in between, but then at school there's these green spaces that they can engage with. So I think that, so for example, I've done this both in preschools, but also in sort of a K-8 space. I partner with a school in Chicago, so in kids in older ages, so it's not just isolated to preschool. And I was actually hoping in these spaces to get sort of a dose response, meaning having kids getting lots of different amounts of outdoor time to sort of dial in on that sweet spot of what many people want to know is, what is the right amount of time that kids should be outside? And what I found was actually, I could not do that because there were very few kids in the middle, meaning there were not a lot of kids whose families wanted them to be outside, but there just was not enough time in a week to get them outside. And so really it was very bimodal, that kids who had time outside in school, that is like 75 to 90% of the outdoor time they get a week. independent of what the parents want, right? So these are parents who would like their kids to be outside. So I think that's really important to think about, is that schools matter as well. And I think also doing health economics analyses is really important. So to inform return on investment. And I'm currently doing a health economics analysis that's just including physical activity and academic benefits for kids. And while that's currently under review for publication, I will share that it's incredibly promising that investing in green spaces in schools or in outdoor preschools has a significant return on investment if we only think about the health benefits that are physical activity and associated consequences and the academic benefits. So I think from a policy and educator space, I think the summary is schools matter and there's a significant return on investment from a physical health and academic health perspective.
I think your response there kind of lends into this next question a bit, but is there an amount per day of outdoor time that research show that children need in order to receive these health impacts?
There's good news and bad news here, right? The bad news is we don't know. Okay, so I'll start with the bad news because I like to start there. There's lots of opinions. If you go into Google and say how much time should kids spend outside a day, you're going to get a huge range. And a lot of this is opinion based. There's not a strong evidence base for amount of time that kids need outside. There's a lot of reasons for that. One, it's very hard to figure out. Two, the quality of the outdoor space matters. So just measuring time, right? If a highly nature focused outdoor space is measured, and another space is, well, I guess the language I use to summarize this is a park is not a parking lot. So both of those are outside. So if you measure time kids spend in a park and say this amount of time is good, then you measure kids in a parking lot, which is a kind of an absurd example, but a lot of school spaces in particular are asphalted, okay? So what I land on most consistently is an hour and a half a day. And the reason for that is because that is the guideline in Washington State. And the reason that's a guideline in Washington State, and this is sort of a state determined guideline, is that that's how much physical activity kids are supposed to get outside every day. And so the recommendation, I mean, it's what I work with because it's a state level policy, so it allows me to align with some state level decision makers. I think it also makes sense, but I would say the evidence base is largely around physical activity, the correlation between outdoor time and physical activity, and not necessarily just outdoor time. Okay, so I'm providing an answer with a lot of caveats, and that I think that work in this space is really important, and that it's very hard to do. So anyone who's hearing this, who's trying to do this work, or, you know, bravo to you. I think it's going to be a bit of a group effort to dial in on what exactly we mean by outdoor time, what exactly we mean by how much time they're in that space. Is it just when they're physically active, or are they just in the space? My belief system is that time outside, physical activity is critically important, but there's a whole plethora of other benefits to being outside that include, as Allison mentioned, a whole human, right? Like well-being, mental health, community health. There's just so many other features involved, and that, while an hour and a half is maybe a reasonable place to land today, there's a lot more we need to do in this space to learn more about it.
I like that Washington State even has that guideline to begin with. I'd be curious if other states have that as well. I know, shameless plug for NatureQuant. If no one knows of that application, it's through your phone and it tracks, you know, your time spent outdoors, the quality of the nature exposure as well. And it's pretty eye-opening. If you've never tinkered around with it, I encourage you to do so because, you know, I live out in the mountains, I live in nature, I trail run regularly. I thought I was getting incredible access to outdoors, but I really wasn't getting as much time as I thought I was. And it was just a great way to track that from adult perspective. I don't know if you know, we want to encourage children to not have cell phones on them all the time, but very, very interesting app if you've never heard it. I think it could be great for people to dive into here. Moving on, but this last question is for all panelists. From your vantage points, what are the most promising opportunities to align public health and outdoor recreation? And how can we ensure outdoor access and recreation opportunities reach communities most affected by inactivity, chronic disease, and environmental justice? So Rohan, that was kind of what you were hitting on earlier in your response. But if anyone wants to dive in.
Well, I can jump in and get us started. It's such a big question, but there are lots of opportunities, I think, to better align public health and outdoor recreation. And overall, I think it's becoming more aligned. We've seen a lot of progress in this area. I think public health has been really moving in this direction for quite some time, better understanding the essential role of green space and parks and trails on quality of life. I think the COVID-19 pandemic really drove this home, right? We saw how essential these spaces were for our physical, mental, social well-being at that time. I think in terms of, opportunities, we have also seen progress in integrating parks and recreation and investments in the built environment into a lot of leading public health frameworks and initiatives. It's called out in things like Healthy People 2030, Active People, Healthy Nation, the National Physical Activity Plan. There are official recommendations now from the Community Preventive Services Task Force. And so it is getting that endorsement from our leading public health agencies, which is really exciting. But some things we could do better would probably be to better integrate investments in parks and trails and green spaces into additional funding streams and better align really investments in more prevention focused work from treatment. So that big picture challenge of we spend so much on healthcare in this country, but only a very small percentage of dollars is going to prevention and really public health measures. And parks and recreation could be one of those solution multipliers if we sort of change that formula. I think another opportunity would be to consider how we bring other sectors into this work. Transportation is a really great example of federal investments and a federal agency that's being leveraged to invest in active transportation and alternative transportation that connects people to parks and leverages trails and greenways and gets more people moving for those physical health benefits. Programs like I saw Safe Routes to Schools mentioned in the chat earlier, but Safe Routes, Safe Streets for All, Transportation Alternatives Program. There's a lot of funding that's available to improve the built environment and connect people to everyday destinations, including parks. And increase that use of those spaces while promoting active, healthy, safe transportation. So I think those multi-sector, multidisciplinary partnerships are really crucial to this work. And so who else can we bring into this mix, whether it's planning, healthcare, law enforcement, at both the federal, state, and local levels. But I think really surrounding the problem and leveraging all the resources that exist to improve community design is a strategy we could dig a little bit deeper into.
Yeah, I think you hit it right squarely, that it just really shows how multi-layered this work is, from the individual to the community to the policy level. We need to get everyone at the table, so really helpful. I think another one would be for all of you, if funding was not a barrier, what would you start research on tomorrow to expand this connection between outdoor recreation and physical health, and working on that multi-system approach that you were just talking about, Allison?
Well, I'll start, because if funding was no barrier to my research, I think that I would partner much more broadly. So my research is really limited by the scalability of my work and how much it costs to do work on a broader scale. So for example, partnering with communities, I really echo what Allison says, that engaging community is so critical. But for example, I live in the Seattle area, so while I can travel fairly far, and we do travel fairly far, I'm still isolated to Washington State. Or if some of my partners in Chicago, I can travel to Chicago. But I think scaling would be so important. We could do this work on a national level if we had more funding to do it and we had more human power, and that would just accelerate the generation of evidence to fuel sort of many of these causes, I think. I would also include additional really cool health outcomes. So there's a lot, like, I think a lot about what we're measuring and how to capture the impacts on health. Gut microbiome is one. I was sharing sort of stress biomarkers like cortisol and pro-inflammatory cytokines. You can also do really interesting epigenetic work, which is not scary to people. It's not like genetic work. It's just really looking at the functional features and how our bodies are responding. But all of this is expensive to do. And I am largely funded by the National Institutes of Health. And so there's a sequential barrier there, right? And so I think scaling the work with more partners to look at more really innovative health impacts is what I would do.
Yeah, and hopefully these are the kinds of conversations and collaborations that will redefine, what healthcare looks like in the next decade. And we're hoping to continue that, with this webinar series and our National Executive Forum happening next year. We do have a few minutes, and Rohan, I want to give you the opportunity if you had anything to weigh in there before we move to.
The only thing I'd bring up, this is also more like a personal interest. And I know we're talking about getting off the screens, but just the role tech and like wearables and apps like Strava and Garmin and all these things. Cause I know me personally, like I get that motivating. I'm like, oh, I got to bike that 1 more mile, or, oh, I get my steps in. And I'm really curious to see the positive and negatives and, how much it helps, how much it potentially harms, levels of physical activity. And I know there's some work going on right now. HA is involved in a little bit of it, but yeah, if that was no barrier, because I feel like that's just only going to be emerging. It's already.
Absolutely. I do want to give us some time for some audience Q&A. It looks like we've had some great questions come in. So I'm going to start with a first one here. What barriers do you see communities facing when trying to implement or scale nature-based health interventions? That might be a good one for you, Allison, if you have anything to weigh in there.
Yeah, I mean, I think, top of mind for certainly our members who are all, local government, park and recreation departments is funding. That is a very real challenge. Park and recreation systems are underfunded, and they're often the first on the chopping block during difficult economic times. We've heard from so many of our members across the country this year, who are facing uncertainty, but have had to reduce budgets and pull things out like capital expenses and programs and staffing. So it takes resources to operate these spaces and to manage them and to do all of the things that we were talking about in terms of community engagement and partnership building. And, like even partnerships with healthcare providers. Park prescriptions is all the rage right now, and there's a lot of excitement around that. But how do we create these interventions and programs that are sustainable and are not just sort of one-off investments between a physician and a small group of patients, and really make them systems-wide changes? So I think funding is one of the top barriers that we hear about. I think, public support and understanding of the value that parks and green space provide. We still have a long way to go on that as well. But overwhelmingly, our data tells us that, this is a bipartisan issue. The vast majority of Americans are supportive of investments in parks and recreation and programs. They want to live in communities that have these thriving park systems, and they want to engage in those spaces. And so I think there are some real opportunities there, but still have some room to build the public understanding of how many benefits these spaces can provide, and back that up with the investment in budgets.
Great. We had another question. Are there any numbers or data about the well-being of veterans utilizing outdoor activities, whether through parks, trails, etc., particularly interested in reduction of suicides? And hate to put it back on you, Allison, but that might be another good one for you.
Yeah, not off the top of my head, but certainly there is quite a bit of, I think, data and studies that have been done on this, and a lot of organizations that work in this space. We do work with military recreation, and I know that we've published a couple of articles around this topic and programs specifically designed for veterans or folks that are experiencing PTSD and engaging them in outdoor recreation opportunities. And the evidence is strong for those interventions. I can pull a couple of those from our kind of content and definitely share those out with the group.
Yeah, the only other thing I add, I know we talked about it a little bit before. The Explore Act did, I know, contain some provisions about getting more veterans in parks and how to improve that access and how to, whether it's employment or through, just outdoor recreation. Can find some more details. I think OOR, you have a good resource when you did the explainer on that bill. So there is some efforts being done or should be continuing to be done.
Definitely. Amber, I saw you went off mute too. Did you have anything to add there?
Oh, there's good work in the space. I don't do it, but there's researchers committed to this. I sent a link. That's one of my favorites that I share. So while I can't speak to it specifically, I sent a link that is specific to veterans and veteran health.
Thank you. And I know we have a lot of our state offices of outdoor recreation on today. They are doing great work in this space as well as the Explore provisions you mentioned, Rohan. We also are going to be exploring this more in depth actually in our next webinar in the series, really focusing on, mental resiliency, including, veteran health, PTSD recovery, things like that. So definitely tune in for the next one as well for that focus. Another one we have is that at Nevada Outdoor School, we get to experience firsthand how exposure to the outdoors and nature has enormous physical and mental health benefits. I wonder how outdoor recreation safety skills and outdoor ethics education fits into the outdoor recreation business landscape.
I'm happy to jump in. Oh, go ahead, Amber. Go ahead.
Well, I think I can provide a very brief response because this is related to schools and sort of the cost and the return on investment. But I think that's just a small piece. And that is that when I'm doing my health economics analyses, I incorporate the additional safety training and general training of teachers in the cost of an outdoor school program. So that's included in the return on investment calculations that I'm doing. That's a very researchery kind of specific response. So I'll turn my microphone off and open the floor for Allison because I'm sure she has a lot more to share here.
Yeah, I think I would just add that when we are doing that type of research, we're really looking at the overall economic return on investment across multiple dimensions and sectors. And so I would just point to some of the research that we've done. But I think in terms of we're looking at the overall access to green space in communities, and we often encourage our agencies to engage in shared use partnerships with school systems. I think those are some of the other largest landowners on the ground in communities. And we definitely are focused on leveraging those for after school hours, out of school time, community use as much as possible. We see a lot of partnerships where the Park and Rec department at the local level will come in and manage those facilities after hours or take care of the maintenance of those spaces. So definitely it's the big picture focus on access to green space, and green schoolyards are certainly part of that, as well as, community play spaces that might be on school property.
Awesome. Thanks, Allison. I think we have time for one last question. Do you have any research or resources on benefits for children with chronic conditions or those undergoing cancer treatment? I think that's a really interesting question. Has anyone ever seen, outdoor recreation being used as a health measure for those battling cancer, specifically among children?
There is some research in this space. It's a little bit more in the space of, and I'm not completely up to date on it because it's not largely part of my day-to-day work. But there are a number of children's hospitals that have been developing sort of green spaces within the hospital footprint so that inpatient kids and also kids who may be visiting outpatient but regularly have sort of access to these spaces, and that there are benefits of having these spaces to the degree that hospitals want to invest in them. That's most of what I know, though.
Yeah, I can't speak as much to cancer, but yeah, for chronic disease, heart disease, diabetes, there's definitely our research arm funds a lot of that. I mean, I can't think of any like specifics right now on top of my head, but there's definitely lots of research that we're involved in that, that academics are involved in. So definitely for chronic disease, hands down.
Awesome. I think I have one more question for you guys. Very short, it can be quick fire. What's your call to action for all of us on this call today?
I have two.
Okay.
One is think about researchers as a partner in all the work that you're doing. I love to partner with people in different areas, not just researchers, not just schools. So as much as research can support your efforts, the more we hear about what we can do to inform all your work, the merrier. And two, I would just say as much as possible, synergize and work together. I find that this space can be sort of segmented in a way that often feels confusing to me. I don't know which groups of people are working together or not. So any efforts to synergize and streamline efforts, I think, would be more efficient and a little bit less confusing to people who are outsiders like me, who don't know all we need like a network, like an org chart, but of like all the people doing this work.
I'll stick with the focus on two calls to action as well and echo what Amber said. I would add that would love for you to advocate for greater investment in parks, trails, green spaces, programming, community engagement, public awareness, all of the above. Let's really invest in these systems as they should be invested in as that critical public health solution. And that's at the federal, state, and local level. And then I would say engage in your own local park and with your local park and recreation department. If you're in the healthcare space and looking to start some type of park prescription program, or you just want to understand the benefits that Parks and Recreation can provide to you as an individual or a community, participate in a program, head out to your local trail, volunteer, really experience those benefits on your own and as a community member. I think change really happens at that local level. So just encourage you to get out there and get engaged.
I'll keep mine quick because I know we're getting on time. One thing federally, tell your representative to co-sponsor the Every Kid Outdoors Act, make that program permanent, as well as expand the program to fifth graders. There's many other legislative issues that I could be like, do this, this, and this, but that's one concrete that just got introduced by Rep. Ansari. And then, yeah, try to enjoy some time outdoors today if you haven't already.
Love that, Rohan. I was going to end with that as well. Huge thank you to all of you as panelists and for all of you joining us today. This webinar was recorded, so it's going to be up on our YouTube channel shortly. As I said earlier, our next session in this series is going to focus on mental health benefits of outdoor rec, focusing on how outdoor access can just really become that central pillar in promoting mental well-being and societal resiliency. Follow us on our social channels for updates on this work in the series. Now, as Rohan said, go get your hour and a half outdoors according to Amber and have a great rest of your day. Thanks, everyone. Bye.